Picture this. It's 2 a.m., your baby is crying inconsolably, and their forehead feels like a hot potato. Panic sets in. What do? Stay tuned, because by the end of this video, you'll be equipped with the knowledge to handle this and other common baby illnesses like a pro. Welcome to the roller coaster ride of parenting, where sleepless nights and sniffly noses are part of the package. But fear not. Today, we're diving into the wild world of baby health, specifically managing those pesky illnesses that pop up in the first year. From snotty colds to fiery fevers, we've got your back with tips, tricks, and a sprinkle of humor to keep your sanity intact. The common cold. Snot Central. First up, the common cold. It's like the uninvited guest who crashes your baby's nasal party and refuses to leave. Symptoms? Think runny nose, a cough that sounds like a tiny bark, and a vibe that screams, "I'm not feeling it." Your little one might be fussier than a cat in a bathtub, and sleep. Good luck with that. But don't throw in the towel just yet. Here's how to fight back. Grab a bulb syringe or nasal aspirator to suck out those boogers. It's like a mini vacuum for tiny nostrils. Fire up a cool mist humidifier. It's basically a spa treatment for your baby's stuffy airways. Keep the fluids flowing. Breast milk or formula is liquid gold for hydration. And no, antibiotics won't help here. Colds are viral, so save the big guns for later. If your baby's under 3 months and spiking a fever, or if the sniffles drag on for days with no improvement, call the pediatrician. Better safe than snotty. Fever. The heat is on next, the dreaded fever. It's like your baby's internal thermostat decided to throw a tantrum. Before you lose your cool, know this. A fever is just the body's way of saying, "I've got this infection on the ropes." Still, you'll want to keep tabs on it. Use a digital thermometer for accuracy. Rectal readings are the VIP of precision, but if you're not up for that wrestling match, underarm or forehead options work. Just know they're less exact. Here's the game plan. Dress your baby in lightweight gear and keep the room cool. No sauna vibes needed. Push fluids like a hydration superhero. Dehydration is the real villain here. Acetaminophen or ibuprofen can tame the heat, but check dosages and chat with your doctor first, especially for babies under 6 months. Red flags? If your baby's under 3 months and hits 100.4 degrees Fahrenheit, 38 degrees Celsius, rectally, or if the fever lingers over 24 hours in kids under 2, get help fast. Same goes for lethargy, breathing trouble, or dry diapers. Fevers are normal, but your gut knows when it's serious. Ear infections. Ninja attacks. Ear infections are the stealthy ninjas of babyhood, striking when you least expect it. Signs include ear tugging, fussiness that rivals a diva, sleep woes, and sometimes a fever tagging along for the ride. They're often the sequel to a cold, with fluid building up behind the eardrum and turning into a bacterial battleground. Here's how to counterattack. Ease the pain with acetaminophen or ibuprofen. Pop a warm compress on the ear. It's like a hug for those tiny canals. Antibiotics might enter the chat if it's bacterial, but many clear up solo. Prevention? Breastfeeding boosts immunity. Dodging secondhand smoke cuts the risk. And vaccines, like the pneumococcal one, are your secret weapon. If these ninjas keep coming back, ask about ear tubes. It's like eviction day for ear trouble. Diaper rash. The bum rebellion. Diaper rash, the red badge of babyhood. It's your baby's backside waving a protest sign. Change me more, human. Wetness, friction, or a sneaky yeast infection are usually the culprits. To keep it at bay, swap diapers often, especially after poop bombs drop. Slather on barrier creams like zinc oxide, it's armor for tender skin. Let that bum air out diaper free for a bit. Freedom feels good. Already red? Gently clean with water, pat dry, and pile on the cream. If it's stubborn or looks angry, antifungal cream or a doctor's visit might be the fix. With some TLC, that booty will be smooth sailing again. Colic. The screaming audition. Last but not least, colic. It's like your baby's auditioning for the loudest screamer award, and you're stuck judging. Defined as crying marathons for no clear reason, usually late afternoon or evening, it's a test of endurance. Look for intense wails, clenched fists, an arched back, and a face redder than a tomato. Survival tips. Swaddle tight like a baby burrito. Crank up white noise or rock gently, think of it as a lullaby remix. Try a warm bath or tummy massage to ease the chaos. Car rides or stroller walks? Sometimes they're magic. If fever or vomiting crash the party, or you're just worried, call the pediatrician. Good news? Colic peaks around 6 weeks and usually fades by 3-4 months. You've got this. When to sound the alarm, knowing when to seek help is pure parenting power. Watch for these red flags. Breathing that's fast or labored non-stop, vomiting or diarrhea, dehydration clues like fewer wet diapers, sleepiness that's next level, or unresponsiveness, sky-high fever, especially in tiny infants, anything that screams wrong to your instincts. Better to overreact than underreact with your baby's health on the line. So, the next time it's 2 a.m. and your baby's running a fever, you'll know exactly what to do. No more panic, just calm and confident parenting.